How do you know if you're an artificial disc candidate for your neck? I would say this: if you've been having neck pain and shoulder blade pain where you're rubbing your shoulder and you keep thinking it's muscle pain, it's usually not muscle pain. It's usually a little nerve irritation. And that's from the disc in the neck. It's very common. Usually we don't treat it surgically. But if this has lasted 8 to 10 weeks, you might want to come in, get an evaluation. 60% of the people I see I do not recommend surgery on. If the neck pain is persisting, if it starts shooting down your arm, numbness, tingling, weakness, getting severe, then we need to get an MRI, do further evaluation, and contemplate possible surgery. I am anti-fusion. I am all about motion preservation surgery and disc replacements, and I will help you decide if you're a good artificial disc candidate.